3 confirmed cases of the measles in northern Utah are causing public health officials to keep a close eye on who's walking through the doors of hospitals, health clinics, and even schools. Those who may have been exposed should also be ready to face isolation and quarantine up to 21 days.
Like if you're going to the emergency room that you have someone that was exposed to the measles out in the car, could they come out and help and get a mask on that person and get them escorted as soon as possible into one of our isolation rooms.
Those infected are highly contagious even before they begin showing a rash, which appears later.
Very red eyes, cough, runny nose, and a high fever. And there's also something they look at in the mouth, which is called Koplik spots. That's pretty diagnostic for measles.
Since the measles outbreak, the Southwest Utah Public Health Department has seen an increase in vaccination requests among concerned parents and even adults.
The cases that we're seeing now in the current outbreak range in age from 7 months to 70, so it's the full age of people, but it's hardest on children. It seems to be that they have a harder time with it, and we've got a lot of children in the United States in this outbreak that have ended up in intensive care.
That swelling of the brain, it can lead to severe ear infections that result in deafness. And some patients that get the infection can also develop a rather significant pneumonia that occasionally leads to death.
Babies under a year old are the most vulnerable to the measles because they are too young for the vaccine.
He's definitely on schedule. I'm a firm believer in vaccinations. I think that especially the measles outbreak, is a real tragedy because it's so preventable.
Public health officials say vaccinations are the best line of defense against the measles.
It's the Utah school rule, but before you go into kindergarten, you've got to be caught up on all vaccines or have an exemption. And then there's another threshold when you're entering 7th grade. There's about 3 shots you need to do to update at that point.
Heaton says there are those rare occasions where children may have reactions to immunizations.
Or you have a child that has some kind of an autoimmune deficiency. And so if you're unvaccinated on purpose and you get that disease, you're putting those people at risk.
If you have herd immunity, and let's say with this disease you have 95% of the population immunized, that protects that 5% of the population that cannot be immunized.
And those who want to file for an exemption may do so for various reasons.
They vary state to state, but exemptions in Utah, if you don't want to get vaccinated, can be for medical, religious, or personal reasons. And personal would cover just about anything because you just don't want to get the vaccine for any reason.
Healthcare workers are also among those who are required to be immunized. And they say if you aren't sure if you've received your MMR vaccinations, it won't hurt to get another. So far, no deaths have been reported as a result of the recent measles outbreak. In St. George, Melissa Anderson, KCSG St. George News.